Imagine your brain as a vast library, each book a memory or skill, carefully cataloged and waiting to be retrieved. Every shelf holds stories of your life, faces, names, places, and the knowledge you've gathered over the years. This library is unique to you, a living archive of your experiences and the wisdom you've gained. Now, picture a thick, creeping fog rolling in, slowly obscuring the aisles and making it harder to find the right book, or even remember where things are. The familiar becomes unfamiliar and the once clear paths between memories start to blur. This is what Alzheimer's does. It slowly clouds memory and thinking, making it difficult to recall even the most cherished moments. Simple tasks become confusing and the world can feel like a maze with no clear exit. Welcome to the Life Matrix, your ultimate guide to optimizing your health. Today we'll talk about Alzheimer's disease and its effects on our health. Alzheimer's is not a normal part of aging. It's a progressive disease that changes the brain's structure and function, affecting millions of people and their families worldwide. It doesn't just steal memories. It alters personalities, relationships, and the very essence of who we are. It's the most common cause of dementia, a term for memory loss and cognitive decline that disrupts daily life. Everyday routines like making breakfast or recognizing loved ones can become overwhelming challenges. The disease is named after Dr. Alois Alzheimer, who, over a century ago, discovered abnormal clumps called amyloid plaques and tangled fibers known as tau tangles in the brain. His groundbreaking work laid the foundation for our understanding of this complex illness. These changes disrupt communication between nerve cells, leading to their gradual death, often years before any symptoms appear. The brain's intricate network begins to break down, affecting memory, judgment, and even the ability to speak or move. The journey with Alzheimer's is unique for each person. For some, the fog descends quickly, erasing memories in a matter of months. For others, it's a slow and gradual process, with good days and bad days, moments of clarity and confusion. This unpredictability makes it especially challenging for families and caregivers who must constantly adapt to new realities. The emotional toll can be immense, as loved ones watch someone they care about change before their eyes. Science is working tirelessly to slow, and one day, stop this disease. Researchers around the world are searching for new treatments, better diagnostics, and ultimately, a cure. By talking openly about Alzheimer's, we reduce stigma and empower families to seek help early. Support groups and education can make a world of difference, offering hope and practical advice. This is not just a medical issue, it's about our memories, relationships, and identity. It's about the stories we share, the bonds we form, and the love that endures even as memories fade. As we explore symptoms, diagnosis, and treatments, remember the human story at the heart of this disease. Every person with Alzheimer's is more than their diagnosis. They are a parent, a friend, a neighbor, a storyteller. It's a story of courage, love, and hope. A testament to the strength of the human spirit in the face of adversity. Understanding Alzheimer's is the first step toward compassion and effective care. Knowledge empowers us to support those affected and to advocate for better resources and research. Let's bring clarity to the fog and offer guidance to those navigating its challenges. Together we can help families find their way, even when the path is uncertain. By demystifying the disease, we can help families provide the best care possible and ensure that no one faces Alzheimer's alone. Alzheimer's touches the core of who we are, reminding us of the value of every memory and every connection. Together, we can bring it out of the shadows and into the light, offering hope, understanding, and support to all those affected. Early Alzheimer's symptoms are subtle, often so gentle that they slip by unnoticed at first. Many people assume these changes are just a normal part of getting older, but there are important differences to watch for. The most common sign is memory loss that disrupts daily life, forgetting recent conversations, misplacing items, or missing important dates more often than before. People may ask the same questions over and over, or rely heavily on notes, calendars, and electronic reminders to keep track of daily tasks. Planning and problem-solving become difficult. Balancing a checkbook, following a familiar recipe, or managing bills can suddenly feel overwhelming and confusing. Confusion with time or place is common. Someone might forget where they are, how they got there, or what day it is, even in familiar surroundings. This disorientation can be frightening as the brain struggles to process reality and make sense of the world. Mood and personality changes may appear. Someone once outgoing may become withdrawn, anxious, or even suspicious of loved ones. Poor judgment, like giving away money to strangers or making risky decisions, can occur without warning. Loss of interest in hobbies and social activities is not a choice, but a result of confusion, anxiety, and sometimes even embarrassment about their struggles. Social situations may feel overwhelming, leading to withdrawal and isolation from friends and family. Recognizing these patterns early is crucial for seeking help. Early intervention can make a significant difference in quality of life. Early detection opens the door to support, resources, and better care, helping both the individual and their loved ones navigate the journey ahead with hope and understanding. In the middle stage, symptoms intensify and support needs grow. Memory loss worsens. People may forget personal history or confuse loved ones. Communication becomes a struggle. Finding words or following conversations is difficult. Repeating questions or stories is common, not out of stubbornness, but because the brain can't hold on to information. Behavioral symptoms like anxiety, agitation, and wandering increase, especially in the evening, sundowning. Delusions and hallucinations may appear, adding to the challenge. Daily tasks like dressing and bathing become too complex, requiring hands-on help. Caregivers shift from supervision to direct assistance, ensuring safety and dignity. Patience and simple communication are essential. The journey is demanding, but support and understanding make a difference. This stage tests resilience, but also deepens the bonds of care. In late-stage Alzheimer's, the fog is complete. Cognitive and physical abilities are profoundly lost. The world becomes unfamiliar, and even the simplest tasks are no longer possible. This stage is marked by a deep sense of vulnerability, as the person is almost entirely dependent on others for survival. The person may not recognize loved ones or respond to their environment. Familiar faces and voices often bring no spark of recognition, leaving families heartbroken as connections fade. Communication is reduced to facial expressions or sounds. Words are rare. Sometimes a fleeting smile or a tear may be the only way they express themselves, making every small response precious. Physical decline means they may be bedbound and need help with every aspect of care. Simple movements like turning in bed or sitting up require assistance, and the risk of complications like bed sores increases. Feeding and swallowing become difficult, increasing health risks. Meals must be given with patience and care, as choking and malnutrition are constant concerns. Comfort and dignity become the focus. Gentle touch, soothing voices, and music can still connect. Even when words fail, these small gestures can bring moments of peace and reassurance. Caregivers must interpret nonverbal cues to meet needs. A grimace, a sigh, or a restless movement may signal pain or discomfort, requiring constant vigilance and compassion. Palliative care is essential, prioritizing quality of life. The focus shifts from cure to comfort, ensuring the person's final days are as peaceful and pain-free as possible. The demands on caregivers are immense, often requiring round-the-clock support. Emotional and physical exhaustion are common, and support for caregivers is vital. Families face tough decisions about hospice and end-of-life care. These choices are never easy, but they are made with love and the hope of providing comfort. Despite the heartbreak, love and connection endure. Small acts of kindness and presence become powerful ways to show care. Honoring the person's life and providing comfort is the final act of care. In these moments, families find meaning and closure, cherishing the memories that remain. Diagnosing Alzheimer's is a detective process. There's no single test. It starts with a detailed medical history, often involving family input. Physical and neurological exams rule out other causes of memory loss. Cognitive tests assess memory, problem-solving, and language skills. Brain scans like MRI or CT look for shrinkage or other issues. Advanced imaging such as PET scans can detect amyloid plaques. Diagnosis combines all these clues for the most accurate picture. Early diagnosis is key to planning and care. There's no cure for Alzheimer's, but treatments can manage symptoms and slow decline. Cholinesterase inhibitors boost brain chemicals for memory and learning, helping some people for several months. Memantine, for moderate to severe cases, protects brain cells from damage. Sometimes both drugs are used together for better effect. New anti-amyloid antibody therapies target the disease's root, removing plaques and modestly slowing decline. These drugs aren't a cure and can have side effects, so decisions require careful discussion. Medications work best as part of a comprehensive care plan. Non-drug approaches and strong caregiver support are essential. The goal: improve quality of life and maximize independence. Non-drug strategies are vital for quality Alzheimer's care. Creating a safe, structured environment reduces confusion and anxiety. Routines and clear labels help maintain independence. Engaging activities like music, gardening, or simple chores draw on past interests and abilities. Physical activity, even gentle walks, improves health and mood. Communication should be simple, clear, and patient. Nonverbal cues like touch and smiles matter. These approaches validate identity and foster connection. Caregiver support is crucial. Burnout is real. Support groups and respite care offer relief and community. Taking breaks and seeking help are signs of strength, not weakness. A healthy caregiver provides better care. Compassion and understanding benefit everyone involved. Alzheimer's research is advancing rapidly, bringing new hope. Scientists are targeting not just amyloid plaques but also tau tangles and brain inflammation. Drugs in development aim to clear tau or calm neuroinflammation, opening new treatment avenues. Combination therapies may prove most effective, much like in cancer or HIV. Prevention is a major focus. Studies show that heart-healthy habits benefit the brain. Managing blood pressure, cholesterol, and staying active may reduce risk or delay onset. Early diagnosis is becoming easier with blood tests on the horizon. Imagine a future where a simple test can catch Alzheimer's before symptoms start. The pace of discovery is accelerating, bringing us closer to prevention and cure. Hope for families is stronger than ever. Alzheimer's affects entire communities, not just those diagnosed. Compassion and support are essential for both patients and caregivers. Simple acts, listening, offering a break, or sharing a meal make a big difference. Community resources and support groups are lifelines for caregivers. Advocacy for research funding and awareness reduces stigma and drives progress. Early diagnosis opens doors to treatment and planning. Dementia-friendly communities help people feel safe and included. Science and humanity must go hand in hand. The future holds real hope, but present needs remain urgent. Let's support research, embrace families, and work toward a world free of Alzheimer's. Together we can make a difference. If this video gave you something to think about, don't forget to like and subscribe to the Life Matrix.